Hello. Do I look like I was in same as tutorial 7? Yes, because it's just a few minutes after tutorial 7. But moving right along, lecture 9, the last lecture I'm going to do. I outsourced lectures 10, 11, and 12. Woohoo! So this is it, my swan song. What do I want to tell you now? Database consolidation, database linking. Shut that door. Cool. What about it? So the final thing we're going to talk about is okay, you've got this database, you've got this database, you've got this database. What can you do with it? So what are the trends in databases? So one thing that often happens is you have to uh, do other things with your data. You've got to be able to take your data and you've got to be able to do stuff with it. You got to be able to use it. And what's better than one database? What's better than one database? Two databases. What's better than two databases? Three databases. You don't even get 2 times the value because you get this synergistic effect. Hopefully I'll be able to show you that. But databases are good and more data is better. So database consolidation. Why would you bring data together? Well, first thing is, how would you bring data together? Well, the first way that you bring data together is through linking primary keys. If you want to say, how much did that patient, how many drugs did that patient get, along with what their pathology tests were, well, then you got to be able to link them together. How do you link them together? Well, how do you link databases together? You need primary keys. You need foreign keys. Well, that would be good, wouldn't it? Now, Australia's got a little thing about ID and the whole ID card incident, debacle, we could call it. And so nobody likes to use ID. So just recently, we finally got a healthcare ID. It's called the Individual Healthcare Identifier. You probably hear about that before, and you will hear about it more next semester. But right now, a lot of people don't use their individual healthcare identifier, IHI. Do you use your individual healthcare identifier? Do you know what your individual healthcare identifier is? Deadly silence out there. No, people don't know about their IHI. So because of that, we need linkage anyway. So that's a problem. And we'll talk about that in the second half of this lecture. But the first half of the lecture, we'll talk about why you would want to even link things together. Why is two databases better than one? Oh yeah, I put it to PDF before, didn't I? That was kind of nice, wasn't it? I'm not going to do it this time. I'll just page through it as you do. So why you'd use linkage, how you'd link things together, and then decision support. What's the good thing about having a whole bunch of data? You can use it to help you make decisions. Decision support. Meh. It's like having a Christmas list. It helps, a wedding list, I think they call it. How do you help the people coming to your wedding make decisions about what they're going to buy you? You give them a decision list. You give them decision support by providing them with a list of things that you hope they will give you. At the end, you will know the structure. You'll know what they look like. You'll know what the data decision support systems look like. You'll be able to calculate the similarity between patient names. You'll know about linkage and problems. I promise. So why do we need to link things together? Well, it starts way back when. It starts in the 20s, in the 30s. Everyone had a GP. You'd go to the GP and you'd say, GP, what's wrong with you? He says, you got the croup. And he'd send you off, probably without even a drug, a bit of love and, attention. But now we got all these specialists. If I'm going to get prostate cancer, I want to be seen by the best prostate cancer doctor ever. If client-centered care, I want to be, treat me well. Empowerment. I want to be able to do what I want to do. I want my data to come with me and I want the data to be continuous. I want it to be continuity of care. We want to be able to use that data for other things like health promotion and we want care to be integrated. We want all the data to be integrated together. So we want to have these primary keys, these things that link things up. Decision support needs all that. We'll talk about that next semester. And so data warehousing is one use of consolidated data, not this spread, but it's collecting data, a whole bunch of different kinds of data from a variety of sources and putting it into a single database. So you can do queries on it. You can say, how many COVID patients didn't wash their hands? Wouldn't that be a good query to have? How many COVID patients weren't wearing a mask? That would be very good for the public health people. You could say, hey, if you don't wear a mask, you're going to get sick. Yeah. So the data warehousing allows you to bring data together. And we want to maximize the value. People are collecting data. I got a half dozen students right now in the Department of Health collecting COVID data. Well, wouldn't it be useful if their data was useful? Wouldn't it be useful if they could actually use it for a whole bunch of things? And one of the ideas is, you want to finance, you want to cost. What does it cost for a hip replacement? How could you tell what it costs for a hip replacement? Well, I bought one at the store. It cost $1.99. No, you got to cost it. You got to say what is it? Not the price of it, but what's the cost? Are we making money on our hip replacements? How much did those nurses cost? How much did that gauze cost? How much did that electricity cost? How much did that surgery cost? And the actual hip replacement itself? What is the cost of all those things? So you want to be able to bring all that together. There's a database for electricity costs, and there's a database for nurses, and there's a database for hip replacement parts. Bring it together. Financial service costing across the health sector. Planning, similarly, you want to be able to, do we need a new hospital here? How many different factors go into do we need a hospital? What's causing this disease? What are all the things that cause this disease? Bring together a whole bunch of data. And reviewing, developing indicators. Is the community healthy? Is the community sick? So many things to do with our data. Yeah. So once you bring together all this data, well, it's a breach of privacy, right? The data needs to be private. How do you do it? Who owns it? How do you link the data together? Who owns it? If I got this data from this person and this data from this person, how do you bring it together? Ownership of data. So each one of these things is a job for a health information manager. It's great. Participant knowledge, do we have to tell the people that we've moved their data around? And then is there software that can make it work? So exciting. So, how would it work? You would get data from a whole different places. You'd have a single patient record to be able to link them together, and then you join them together using data relations, and do things like say, what is the total cost, clinical costing? Data needs data from inpatient services, the payroll, accounting systems, and it needs to assess real income against real costs for a service. Break it all down. Really, it's a great job if you like numbers. You can analyze it within the product itself. You can export it to Excel or Access or hundreds of tools and report it. Are we making money on hip replacements? Are we making money on cancer? And are we making people healthy? Is this thing working? Any questions? Anyways, I hope you all get a chance to play with data warehouses someday. I'm sure you will. Data is us. All the students this year on placement are out working with big data sets, and you will likely be just the same. Great. So linkage. So when you've got this data, how do you link it together? So when we all have got an identifier associated with us, then this will not be such a problem, because we've got a primary key. We have something that uniquely identifies us. But now we don't. We have these random human beings that are messy. They oftentimes don't come with their identity number tattooed on their forehead. No, they come unconscious. They come dementia. They come, non-English speaking or too young. Or how do you identify them? Well, they're just like John Doe. How do you? So, and you get better health if they know who you are, if they know your history. Waste time. You don't duplicate stuff. So let's try to identify people. That's what we're talking about. Let's try to link them to their record. That's why we call it linkage. How do you link it? Well, you look at the data. You say, well, is there enough information here to link people together? Somebody walks into the emergency room and they don't know their name. What can you tell about them? Well, they're male. They're 50, slightly demented, right? So is that enough to identify people? He's bald, talks a lot, whatever. So that's probably still not enough. We need a few more bits of information. Let's try to match them up. So we have a variety of information, and the information is of certain quality. It's variable, like, I'm bald, but, next week I might have long hair, reliable. Yeah. They say their name's John. They looked a bit dodgy though. How reliable is the information? And then once you've got information, you try to match that up to your existing data set. You say, well, they say their name's John, and I've got a John in my data set. That's an exact match. Partial match, they say their name's John, and I've got a Jonathan in my data set. That's a partial match. It's not as good. Algorithmic match. Algorithm. Oh, I love that word. Algorithm. It means that, using a computer program to match. They say their name's John, and there's a Johan in the database. Well, the computer has an algorithm that says, those two are pretty much the same. An algorithm, when you type something into Google and it says, did you mean blah, blah, blah? That's an algorithm that tried to correct your spelling for you. And then you use all those things to give it some points, to score things. We're going to learn how to score matches in the next little bit. For example, if two people have the same surname, 40 points. Yay! If they have a partial surname, the first 4 characters are the same, 20 points. If the first 8 characters are the same, 30 points. We're getting there. Algorithmic. All but 2 characters of the name. Woolersheim, but with the EI spelled with IE, 35 points. 80% character match on name, 30 points. Soundex, that's like a sounds like, so Woolersheim and Woolerslime, they sound about the same. So you get 30 points for that one. So you get some points. Exact, partial, whatever. No, I'm going to go do other things. Don't answer the phone. Okay, so the different ways to link things together. Same with the given name. Get some points for that, because John isn't quite as good as Woolersheim, sex match, gets some points for that. Date of birth match, some points for that. Partial match. So different ways to match. And then together, so we've got Heather Grain and Heather Grain and Heather Green, a female. So this Grain and Green, you got 30 points for that. And Heather get 10 points. But both female, you get 20 points. Their birth dates are slightly similar. You get 15 points. Together, that ranks as 15. So you do that, run that program, run that algorithm against all the names in the database. You say, this is probably the one. This is the one it matches the most. Or there's a threshold. You'll say, well, if it's above 70, then it's good enough. If it's below 70, make a new patient file. Do that stuff. There's information about names. I don't care about this. Yeah, decision support. So that's better. So why do we care about it? Why do we want the data? We want the data to help us make decisions in the clinical setting. And so to do that, you need common data definitions. You need common linkage rules and processes. You need to be able to just make the data to that drives the decisions to be common, and that's the rules and processes. Yeah. So, and yeah. For example, what kind of data would you need to support decision making for immunizations for children and remind doctors when immunizations are due? What structure would this data have? So, um, yeah. So, what kind of data would you need? You'd need to know when immunizations were due. You'd have to know data, information about immunizations. When are immunizations due? How often? What's the limit for when to remind people? What are the exceptions? What are the allergies? All that information about the immunizations, and then on the other side, you have to know information about the patients. You'd have to know um, what immunizations do they have? How old are they? What allergies do they have? And then you also have to be able to put that into the doctor system, the doctor uh, data system to be able to remind them, so you can send them information. That's it. That's it. That's it. That's the last lecture, number 9. But probably maybe the last one I'll ever do. Remember me in this moment.